Good morning everyone. Myself Dr Kirti Chabda, Assistant Professor, PPT Department, RPIIT Karnal. Today we'll discuss about the sport-specific injuries in water skiing and their management. Propeller injuries and lacerations. These are the most common injuries sustained due to the recreational water. Mechanism of injury. Boat collisions when moving propeller strikes a person, which may occur to the fallen skier or boat occupant upon falling the boat. Drivers' inattention and inexperience. Alcohol usage. Management. Propeller injuries and lacerations may be severe and should be managed promptly according to emergency principles regarding airway, breathing and circulation priorities. Bleeding should be controlled by firm direct pressure at the site. All wounds must be considered contaminated and strict surgical wound care principles should be followed. Spine injury. The majority of injuries to the spine are minor sprains and strains. Fracture or cord injuries do occur. They are most frequently located in the cervical spine. Mechanism of injury. Sudden transient deceleration forces that occur with falls during high-speed slalom, barefoot and jump skiing. Management. The spine should be immobilized to prevent further injury. The cervical spine may be held in the position either manually or with a collar when the skier remains in the water. The skier is then carefully positioned as a unit on a backboard. Helmets and flotation vests should be left in place and removed only by the trained medical personnel. Fractures and dislocations. Spiral fractures of the tibia and fibula can occur as torsional stresses are concentrated at the superior aspect of the binding. Suspected fracture should be splinted in the water, preferably with available splints or alternatively by taping the injured leg snugly to the opposite leg. Dislocation of the shoulder commonly occur when excess slack is quickly taken up after the skier turns suddenly. Fracture dislocation of the ankle occurs when the ski instructor's leg becomes entangled in the rope upon takeoff. Management. Dislocation should be evaluated by competent medical personnel. They should be reduced promptly, especially if complicated by neurovascular compromise. Early reduction of the acute dislocation is often easier. This may be accomplished in most instances with longitudinal traction and gentle rotational movements. Muscle and ligament strain, sprain and tear. These are the common in both recreational and the competitive water skiing. Hamstring injuries are relatively frequent while water skiing. Mechanism of injury involves knee extension and hyperflexion at the hip, either at the takeoff or upon submerging the ski tips while crossing the boat wake. As it is shown in the figure, the mechanism of injury. Management. These injuries should be treated with the standard protocol of rest, ice and elevation if extremity is involved. Non-steroidal anti-inflammatory medications may be taken by the person without contraindications. Ligamentous injuries. Management. Magnitude of injury, concomitant injuries and patient goals will determine the treatment. ACL reconstruction is favored for the competitive skier who sustains a complete intersubstance ligament tear, the most commonly affected area with majority of injuries occurring to collateral and anterior cruciate ligaments. Enema injuries, falls have been reported to cause injuries to the vagina, rectum, tympanic membrane. Enema injuries often present with bleeding and pain. Management. Any rectal or vaginal bleeding must be evaluated quickly. It includes controlling bleeding, treating hemorrhagic shock as necessary, and surgical repair of the vaginal or rectal wall. Appropriate prophylactic antibiotics should be administered. Most importantly, the majority of these injuries could be prevented if all the beginners and jump skiers would wear protective rubber pants or wet suits. Thank you.